Sean K, your nurse today.
Sean K, your nurse today.
Sean K, your nurse today.
You found what and where? Oh. Okay. Oh, hi. I'm Sean, and I'll be your nurse today. Today we're going to be talking about deep vein
thrombosis.
Or DVTs. DVTs is a condition where blood clots, usually in the legs, and can range from harmless and unnoticeable to mobile and dangerous. Now, does anybody have any questions about DVTs?
Ooh, me.
Yes.
Hi, Nurse Sean. What are some things that can cause a DVT?
That's a great question. DVTs can be caused by a number of factors. Oh, I'm sorry. I forgot to introduce my colleague, Laura. She's quite the expert on nursing knowledge.
So the risk factors for DVTs are as follows. Immobility, inheriting a blood clotting disorder, prolonged bed rest such as hospital stay, paralysis, injury or surgery, pregnancy, birth control, hormonal therapy, being overweight or obese.
So basically,
Cancer, heart failure, inflammatory bowel disease, family history of DVT or PE, as well as a personal history of DVT or PE, varicose veins, age over 60, long periods of sitting such as driving or flying, and a history of heart attack, stroke, and congestive heart failure.
Great. So basically,
And smoking.
a DVT is caused by anything that slows or stops movement of blood from the veins back up to the heart. This is known as venous stasis. You see, normally when we walk around, the contraction of our muscles causes the blood in our veins to move. This is known as the skeletal muscle pump. However, when we stay stationary for a long time, like laying in a hospital bed after surgery, or sitting down for a long period of time, such as on a long plane ride, the blood doesn't get the extra push it needs to move back up to your heart quick enough. You see, when blood sits in one place for a long time, it likes to stick together and form clots. Lots of times this can be asymptomatic, meaning you can't even tell there's anything wrong. However, sometimes there can be other symptoms. Have you been there the whole time?
The signs and symptoms of a DVT can include edema or swelling, pain such as soreness or cramping, and warmth and discoloration at the skin in the affected area.
Like this. Doctors can also run tests like an ultrasound, venography, check your D-dimer levels to determine whether you have a DVT. But if you suspect you do, don't massage the area because it can break loose and then cause all new dangers. Yes, another question.
Yes. What are some of the dangers of having a DVT?
That's a great question. Laura?
I'm on my break.
I didn't realize. I'm sorry. Well, to answer your question, you see, apart from pain and swelling in the leg, DVTs can cause something we call pulmonary embolism. We gotta get that fixed. When a blood clot forms and stays in the place it formed, it's called a thrombus. However, when it breaks loose and travels up the bloodstream, it's called an embolism. And when an embolism goes all the way back to your heart and then to your lungs, it can get jammed in the blood vessels as they get smaller and cut off the blood flow to your lungs. Now this is a potentially life-threatening event. So if you ever have a sudden onset of chest pain, accompanied by shortness of breath and sometimes a bloody cough, you need to seek emergency medical attention immediately.
Lightheadedness, tachycardia.
I'm sorry, what did you say, Laura?
Nothing.
Oh, okay. Well then. Oh, we have another question.
Hi, Sean. Long-time viewer, first-time audience member. I was wondering what type of treatments are available for DVTs?
Yes, thank you for your loyalty. Actually, DVTs can be treated by a number.
Treatments and preventative measures for DVTs include anticoagulation therapy, such as heparin or Coumadin, filters, TPA or tissue plasminogen activators, compression stockings, and sequential compression devices.
Yes, well, as Laura so graciously mentioned, blood clots can be prevented with medicines such as heparin or Coumadin that thin your blood. However, most of the time they're treated with compression stockings or TED hose, which you wear to keep compression on to promote venous blood flow.
Like this?
Not quite.
You want to slip your hand all the way inside and then pull it inside out. Then you want to slip it gently over your toes and heel. Then grab the end firmly and pull it up as far as it'll go, making sure there's no twists or wrinkles. You want it to be nice and tight. Ooh, but not too tight.
Well, that's it. Thanks for tuning in and learning about
Deep vein thrombosis.
I'm Sean K. I was your nurse today.
And I'm Laura.
Hope you learned something.